Hyperfine brain imaging.
Hyperfine, also known as swoop, is a revolutionary bedside low magnetic field technique to obtain images of tissues. Currently, it is FDA cleared for brain imaging. Hyperfine generates brain images that are more like an older generation CT scan images. Therefore, Hyperfine, at this point, is a complement, and not a replacement to regular MRI or CT scans of the brain. Remember that those technologies are matured and time-tested already. The scan times are longer than the regular MRI scan, and depending on what and how many types of sequences are used, the scanning time could be as short as 5 minutes, or as long as 35 minutes. A common sequence is T2 FLAIR, which scans for cerebral edema, takes about 9 minutes.
Hyperfine imaging is a limited study that aims to answer certain few questions. In its use and function, it is very similar to a follow-up head CT scan without contrast. The maximal weight that the bridge can tolerate is 200 kilos, or 440 pounds. The same questionnaire currently in use to clear any patient for MRI will continue to be used and followed. The machine has a permanent, always-on, magnet in place. Do not code or defibrillate a patient with the machine in the room.
Caution. The regular MRI machines in the MRI suites are high-power devices, with high-power magnetic fields. Therefore, those machines can be very dangerous, and must be respected with heightened attention. Never go into the MRI suite with metallic objects or material, or with electronic devices. Always, ask the MRI personnel if it is okay for you to go into the MRI room.
The 5 gauss line is the distance from any MR system at which the static magnetic field is diminished sufficiently to pose no physical threat to the general public. In the Hyperfine machine, it is 5 feet in diameter, or 2.5 feet from center. In the Hyperfine machine, it is marked by the extended yellow hula hoop. Remember, in all MR machines, the magnets are always on.
Advantages of Hyperfine imaging. The brain imaging occurs at the bedside, and with that, the nurse and patient remain in the ICU or floor. Because there is less patient travel, it is probably safer for the patients. And, in intubated patients, since there is no disconnection of the airway tubing, less likelihood of pneumonias. With a much weaker magnet, 64 millitesla versus 1.5 or 3 Tesla, metallic items do not become dangerous missiles. There are a series of operational, logistic and clinical conveniences introduced to the bedside, to include less hospital personnel needed to obtain the necessary imaging, and the CT scan downstairs can continue operating without delays. As with all MRI, there is no radiation exposure. Since the device is much shorter, and people can be closer to the patient, there should be less claustrophobia. MRIs make noise, and Hyperfine is no exception, but the noise is lower than the standard MRs. Consider closing the doors of the other rooms, and reassure other personnel, patients, and visitors. Hyperfine runs from the standard 110-120 volt wall socket.
Disadvantages of Hyperfine imaging. With lower magnetic field, comes lower spatial resolution. The images will be somewhat grainy, similar to older CT scans. Also, the images could suffer from more artifacts. The acquisition times will be longer, but less than the amount of time back and forth to the CT suite. At this early stage, there is unfamiliarity with the device and the technique.
To order the Hyperfine imaging, go to Meditech and search for Hyperfine. You may need to discuss with neurology or neurosurgery what studies will be needed. Anticipate that the most common requests will be T2 alone, FLAIR alone, T2 and FLAIR, DWI and ADC, and T2 and T1.
The main indications for use of Hyperfine imaging include follow-up of cerebral edema from any cause. Remember that MR images water well. Diagnosis or follow-up of hydrocephalus or midline shift, including assessing the effectiveness of EVD or when weaning EVDs. And, in patients who are comatose, or with altered mental status who are unable, or unsafe to move out of the ICU or floor. For example, unstable vital signs, too many critical care devices, or positive coronavirus infection.
Steps for Hyperfine imaging. Once the decision has been made, and the order has been placed, then the MRI tech and the bedside nurse collaborate, as usual. The MRI technician will bring the Hyperfine machine to the room, and the nurse and the MRI tech will reposition the bed to accommodate the machine at the head of the bed. Meanwhile, be observant of the 5 Gauss line. Reposition devices and equipment. Always be watchful of the airway. Once the Hyperfine is at the head of the bed, then lower the bridge of the machine and place it flush with the surface of the bed, where the patient will slide into the helmet, which is the coil. Prevent the mattress or cushion from deflating.
Adjust, pad and position the patient in the head of the patient. Be observant and responsive to keep the patient comfortable and safe, including the part of the patient not in the machine. During the entire procedure, continue to watch and monitor the patient. Once the imaging is completed, then carefully slide the patient out of the scanner, before moving and powering off the Hyperfine machine. Cautiously, move the Hyperfine machine out of the room, and reorganize the room.
Anticipate that there will be growing pains. Please, provide constructive feedback to enhance the procedure and system. Please, be patient, kind and curious. It's about working together. Thank you.
The Hyperfine Swoop MRI system is a FDA 510(k) cleared medical device in the United States. As shown, the colored ring on the top of the system is designed to delineate the 5 Gauss line when it's fully extended. The Swoop MRI system is equipped with a simple control panel. The joystick is used for driving and maneuvering Swoop. Prior to transporting the system, make sure that the batteries are adequately charged. A Hyperfine trained operator must accompany the system during its operation. Foot-activated caster locks secure the Swoop MRI system in place. To use Swoop, ensure that adequate space is available around hospital room and the patient bed, and that no electronic equipment is placed directly in front of the scanner. To turn on the Swoop system, plug in the power cable and depress the silver button. Then turn the key into the scan mode. Lower the patient transfer bridge such that it covers the gap between the system and the bed. Place the back pad fully into the head coil. Slide the patient into the scanner's head coil. Padding should be further used around the head and ears to further immobilize movement. During the entire exam, the patient should be monitored by hospital staff. To begin scanning, connectivity between Hyperfine Swoop and the supplied iPad needs to be established. Information can be manually entered or autofilled by connecting the scanner to the hospital network. The Exam tab allows selecting from a list of pre-configured protocols. Individual sequences can also be added and removed. Sequences are initiated by pressing the play button. Be aware of warnings and error notifications via the exclamation mark icon. The Scan tab allows to see the progress of the sequences. From the Scan tab, the image montage can be zoomed and the grayscale can be adjusted. The 3D tab displays various renderings of the acquired data from each sequence. When the exam is complete, a checkmark icon will appear. Press the checkmark icon to complete the exam. Ensure that the images are sent to PACS under the Events tab. Once the exam is completed, the patient should be safely removed from the scanner. Remove the patient from the scanner before powering off the system. To power off the system, depress the silver power button and wait for the white light in the surrounding bezel to turn off. Unplug the power cord. Fold up the transfer bridge from the horizontal to the vertical position. Turn the key into the drive mode and maneuver the system out of the patient's room.